Smoking Cessation Project by Pauline. My patient is a 59-year-old Asian male who has been a chronic smoker for the past 30 years, averaging about 5 cigarettes per day. I educated my patient with a brochure that I created with my classmates from a previous semester about the effects of smoking. I explained how quitting can benefit his health from just 20 minutes of quitting to lifelong benefits. The brochure also explains the risks of smoking, including cancers and chronic diseases, how it can affect the oral cavity, and includes nicotine replacement therapies that can be bought over the counter and some that requires prescription. I introduced a nicotine replacement therapy method to help my patient to quit smoking because I believe that would be the most convenient way for him. Over the counter products are easy to obtain and easy to use and a great way to reduce cravings. These include lozenges, which is like a hard candy that releases nicotine as it dissolves in the mouth, gum that is chewed to release nicotine, and patches that is placed onto the skin that release a steady amount of nicotine throughout the day. According to one study, NRT increases the rate of long-term quitting by approximately 50 to 60%, regardless of setting. These conclusions apply to smokers who are motivated to quit. My patient has been interested in quitting smoking and has tried quitting before. However, he would only last a couple of days without smoking and then pick it up back again. After explaining ways to quit, he said he wasn't interested in any nicotine replacement therapies and wanted to quit naturally. I advised my patient to slowly reduce the number of cigarettes he smoked per day, and he also usually smokes during his breaks at work, so I suggested finding a hobby to do during that time to help quit his addiction. After my patient can successfully reduce the number of cigarettes he smokes per day, we will further assess our next step. Expected outcomes for my patient. In 2 months, I expect him to cut down the number of cigarettes smoked to 2 or 3 per day. And in 6 months, I am hoping my patient is no longer smoking completely.